I'm an infectious disease doctor. I treat any range of infections, fungal, bacterial, viral infections. We also sometimes help teams who think there might be an infection determine that, there's actually not an infection, that there's something else going on. Can help guide the diagnosis as well as the treatment plan. Every infection has a history to it, so I get to hear a lot about people's hobbies, their backstories, any travel, and I just love learning more about my patients. And I also really love that we have a lot of good antibiotics, we have good antivirals, we have ways to cure and treat infections that is always rewarding to see. So infectious disease, I think, is one of the fields that we've seen some of the most exciting advances. Thinking back to the early HIV/AIDS epidemic in the 80s, we've gone from a disease that was practically a death sentence to something that is a manageable chronic condition that's actually easier to treat than something like hypertension or diabetes. Thinking even more recently, of course, the COVID pandemic, that it's more from something that shut down society to something that we can feel a lot more comfortable knowing that we have those vaccines available. Certainly, I love being with patients when they are feeling vulnerable or unsure of what the next steps are, and being able to provide some expertise and guidance, both in treating the condition, but making sure that they feel comfortable and knowledgeable about their treatment path.